with age you get weak. So weakness is like we are talking about the bone and joint health. So there is one thing which is connecting these two, that is muscle. Okay? So your actually the age-related deterioration bone health starts with muscle. So as the muscle starts losing its strength, what we call it as sarcopenia. Sarcopenia means losing the muscle mass. Okay, that is the initiation which actually precedes bone loss or osteoporosis. Okay, so the peak BMD which you attain at the age of 25 to 35 is determined by your physical activity at this age. Okay, whatever physical activity you do, whatever diet you consume is going to determine your BMD or peak BMD we call it. Okay, from now, I mean after this age, bone starts deteriorating. So before bone deteriorates, the first thing to start is skeletal muscle starts losing, because it depends on your activity. The way you do physical activity is going to determine your bone strength. Okay. So because sarcopenia is less aware, osteoporosis has been more talked of topic because of the morbidities it has created. It has been creating, and it will definitely be there. So osteoporosis is not well talked about, but sarcopenia is not much talked. So there are a lot of comorbid associated problems with sarcopenia, and sarcopenia is very prevalent in younger age groups. Okay. So just to understand what is sarcopenia, I just give an idea of what is sarcopenia. So just the lay definition is losing muscle mass, okay, and strength. So it's actually associated with aging. So as the age progresses, along with that, this happens. Okay. So what actually happens is at a molecular level, in skeletal muscle is one thing when compared to bone. It responds to your exercise even at age of 60 also. Even if you start exercise even at 60 years of age, it still responds to your activity. Like if you start building your muscle, doing strength training, even at that age it is going to grow. That is a property of skeletal muscle. It grows even at that time. Okay, but it accumulates. There is a loss of the mitochondrial dysfunction, cellular senescence, everything. That makes it little less responsive. Okay, that is what is the reason for insulin resistance and whatever is accompanying the physical inactivity. Whenever the muscle stops contracting or activity is less, obviously that is going to happen. Okay? That is also a part of the pathology. So this is just a spectrum of all the problems that is going to cause sarcopenia. Okay? So there will be like less protein intake, free radical oxidative damage. So one in diet something is talked about just now. So junk food and all those things is going to create a lot of free radical induced oxidative damage to cells, not only muscles, everywhere. Okay. So more apoptosis will happen. So that is going to kill a lot of muscle cells. Okay. So then hormonal changes, mitochondrial dysfunction. Okay. So and pro-inflammatory status. Okay. So there is a catabolic state and anabolic state. Anabolic state is going to build your muscle, and catabolic state is going to decrease your muscles. And one more thing regarding weight loss and this thing also. So doing exercise without proper diet is also going to be detrimental. That is going to cause a lot of muscle breakdown. Okay, your protein is going to break down because you are not taking proper diet. Because protein are essential, more importantly for enzymatic functions. Okay, which is more essential. So body will extract proteins from the internal what is there, the muscle build which is there. No, that they will take. It will take. So obviously. People who are following whatever is the dietary protocols for losing weight, if you don't take protein properly and stimulate the muscle, obviously protein is going to get breakdown. Okay, that is also a source of sarcopenia. So one of the common reasons for sarcopenia is weight loss also. So if people going for weight loss, they will definitely have sarcopenia without physical activity. So the definition of sarcopenia is loss of muscle mass, skeletal muscle mass, muscle strength, okay, and the physical performance. Okay, so it's defined by Rosenberg in 1997 for the first time. So it is sarx means flesh. Okay, losing flesh. So diagnostic criteria being used, there is a lot of controversies, but and very difficult to assess these things also. Sorry for the text because of some issue. So there are different definitions. One is Asian and European and different things. So first one is lean muscle mass, measuring the lean muscle mass. Okay, appendicular lean muscle mass we call it. See, BMI and these things are getting obsolete now. Okay, so muscle mass is separately measured, and in that also I mean, body composition analysis is coming to picture. There you are measuring separately your appendicular muscle mass and all. So when your appendicular muscle mass is less than 7 kg per meter square, that is then you are called as sarcopenia. So how it is measured, I'm going to show you. And apart from that, because you cannot do muscle mass assessment by DEXA, body analysis and all. So there are simple tools which are going to tell you whether you are sarcopenic or not, your muscle strength is adequate or not. So one among them is muscle strength. If your muscle strength, which is assessed by one common test, is grip strength. So you can use a handheld dynamometer. Digital dynamometers are available now, and analog dynamometers are also available. So you can just do your grip strength. When your grip strength is less than 20 kg, it is also varied by various guidelines, like Asian and European have different guidelines. But for male patients, it is like around 28 to 35 kgs. If it is less than that, they are considered to be sarcopenic. When you measure your grip strength, it is shown in terms of number of kgs. Similarly, for female, it is around 18 to 25. If it is less than that, then it is considered to be sarcopenic. So they are considered to be sarcopenic. Okay. Similarly, performance also, when your gait speed. So like sir said, we have now apps available. Okay, you can do real monitoring, the way you do exercises and all with your body attached devices, rings or watches, everything. So that is going to tell you your gait speed. Okay, how you what is your average gait speed, initiation, acceleration, everything. So if your average gait speed is less than 1 meters per second, then definitely your physical activity is poor. So the diagnostic criteria are like low muscle mass, how they are going to assess also, just we will see. Low muscle strength and low performance. Okay, this is just an algorithm. So just to see whether you are a sarcopenic or not. Okay. So a simple questionnaire is there. Then based on that, when your score is very less, then obviously you consider to be sarcopenic. Then you assess for assessment of the muscle strength is done by grip strength, like I told, grip strength, then chair stand test. Okay, there is a small test where you do single or multiple chair stands test. That is going to give you whether you are physically active or not. Okay. When there is a probability that you are sarcopenic by these tests, then you can assess. It's not mandatory. When your grip strength and chair stand test are positive, that means you are sarcopenic. Clinically, this is just enough to diagnose sarcopenia. If you want to assess skeletal muscle mass, how they are, okay, then you can do DEXA, BIA, CT, MR, everything. And to assess the severity of your muscle strength or the sarcopenia, you can do like gait speed, SPPB, tuck test, and 400 meter walk test. Like long walk test is going to determine you how severe is the muscle mass, muscle loss of strength. This is a questionnaire which is including strength, loss of strength actually. Assistance with walking, requiring any assistance, then rise from chair and climbing stairs and falls. So for strength, how difficult it is to carry a 10-pound weight, it is asked. So if there no difficulty is there, then obviously score is 0. As the difficulty rises, the score increases. Similarly, when for walking, do you need any assistance? The same thing, raising from chair. Do you need arm support while raising from the chair or no? Then similarly for climbing stairs, okay? For 10 stairs average, for climbing stairs, do you need support? Then falls, any history of falls in the past year. Sarcopenia is also very common, as you progresses, now you are in your early 20s. As the age progresses, it is getting commoner in these ages also because of physical inactivity. And why it is not evident? Because there is something called sarcopenic obesity. Okay, you appear like adequate weight, but your body fat is sometimes more than the muscle mass which you are supposed to be having. So that masks your sarcopenia. So that's where that is the point where this is going to tell you. So this is a hand-hand grip, strength assessment, grip strength assessment. So like I told, different protocols are there, 27 to 35 kgs, Asian and European protocols. If it is less than 27 or 35 kgs, then your strength is poor. Similarly for females, okay. Chair stand is the chair, both hand grip strength and chair strength assessed for used for assessment as well as assessing the severity also. So a single point of time, you ask the person or someone who is being assessed to get up from chair without support, crossing the hands over the shoulders 5 times. Okay. If the time being taken is less than 12 seconds in males or less than 15 seconds in is normal. If it is taking more than that, then it is considered to be abnormal, like you are taking a lot of time. you need to break in between, or you are losing balance in between. So all this consider that your strength is not appropriate. Okay, so that's why I told second step after this questionnaire, if you have these two tests are enough, your hand grip and chair stand test. If these two you are not able to do properly, or anyone like your father, I mean your any family members, elderly people also, when you can assess these two things, you can consider okay they have sarcopenia.